Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Now we're going to look at the ETCO2, and conditions where it is increased and conditions where it is decreased. So first is we'll look at the increased conditions. So in case of the increased conditions, talking about metabolism. So under this metabolism, so here there is hyperthermia, Next, there is also presence of fever, and you can have the pain. So fever, pain, shivering, as well as thyrotoxicosis. So thyrotoxicosis. Next, we move on to the respiration. So under this respiration, there is hypoventilation, and there is also the respiratory depression. Next, there is also case of COPD. In increased ETCO2, there is COPD, as well as the partial airway obstruction and rebreathing. So partial airway obstruction, as well as there is rebreathing. Next, we move on to the circulatory aspect. So under the circulatory, there will be an increase in the cardiac output. So increase in the cardiac output, and there is also the hypertension. So there is hypertension as well. Then looking at there is also chances of the apparatus malfunctioning. So apparatus defects. So this can include the exhausted CO2 absorber. So you can tell the exhausted CO2 absorber and inadequate fresh gas flow. So you can also tell inadequate fresh gas flow. Then there can also be the ventilatory malfunctioning. Then we move on to the decrease in the ETCO2. So what are the conditions where there is decrease in the ETCO2? So first is talking about metabolism. There is hypothermia, whereas in case of increased ETCO2 there was hyperthermia, and increased ETCO2 there was thyrotoxicosis, fever, pain and shivering. So here there is hypothermia and also the metabolic acidosis. Next we move on to so this was about the metabolism. Next we move on to the respiratory. So under this respiratory there will be hyperventilation, whereas in case of increased ETCO2 there was hypoventilation. Here there is going to be hyperventilation. And there is also going to be the total airway obstruction. and there is going to be extubation. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.